Great to again to be on the show and to be live stream as well. That's fantastic. I'm glad to be back on. No, my radio's off, so I don't have any feedback. It shouldn't be. It should be okay now, I think. Yes, it happens. I think it's happened to me before. So if you on Facebook, you have to go out of Facebook and then just stay on the Zoom recording. Fantastic. I like your screen today. It looks really nice. It's lovely. And yeah, while you're doing that, I just realized yesterday how important, being on radio is, especially for you as a broadcaster, for doing it for many years. So yesterday, Nicholas Grimshaw on Radio 1 was doing his last show. And I remember listening to him. Now I listen obviously to Hospital Radio Bedford, but I know the journeys, to work and back, and then listening to the radio station, and especially a lot of people listening to radio during the COVID pandemic. It's helped them through. So I just realized how important, for you as a broadcaster being on. So yeah, I mean, I must commend you on just getting up every day and being able to do this. Yeah. It will get sorted. I'm sure it will get sorted. Don't worry. Yeah. Yeah. The volume just seems a little low today on my side, but my volume is high. So I don't know whether the volume on your side needs to go up a bit. No, it's still a bit low. Okay, well, if it's high on your system, I can hear you, but it's not as loud, unless there's a problem with my hearing this morning. But yeah, I can hear you all very clear, but just the sound volume was a little low. Yeah. Sure. And yeah, I mean, well, obviously with the COVID coronavirus update, there's always a lot to talk about. Um, you know, so yeah. Yeah, while you're doing that, just to say, I'm in the news yesterday. We were talking, Ferdinand and I, South Africa, there was a young child that died of COVID-19. I think it was a so it's obviously the third wave is still present in some countries, Australia, South Africa, UK, and some other countries. So we're still in the third wave. So it seems that even younger children are being affected and infected and obviously dying. So it's still a concern, I would say. And I think probably the new strain may be the reason why that younger people are, obviously getting infected and dying. I mean, obviously the statistics is so quite low, but it's just to say, just a warning, that it is happening where young children are getting infected and it's becoming quite serious. Yeah, 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 yeah. I will. Yes, actually, that's a story that I actually wanted to talk about as well. So, I mean, that is quite significant, isn't it? What were your thoughts about that? Yeah. So, I mean, we know that hospital infections is common. When people are admitted to hospital, there's always the chance that if they go in, that they are going to pick up other infections, bacterial. What if the infections are prevalent at that time, like food poisoning or streptococcal infection? So, it's something that we know of. Yeah, streptococcal. So it's a bacterial infection. So that's quite common when you go into hospital that you are exposing yourself and there's a possibility that you can get these infections. These are known as hospital-acquired infection, nosocomial infections. So I'm not surprised that COVID-19, obviously, the statistics is telling us 10 people in UK caught COVID in hospitals in the first wave of the study. And you can understand why, because COVID in itself, COVID-19, the SARS-CoV-2, and the Delta are very contagious. And that is why people had to obviously maintain distance, wear masks, or PPE, the personal protective equipment. Contagious. And also because they wouldn't have been wearing PPE, they would have been in their hospital beds as opposed to the hospital staff wearing protective equipment. So then again, they're at a higher chance of getting it. They're more vulnerable. So really being in hospital, being in an environment where there's a presence of and a prevalence of COVID-19, not having any, personal protective equipment, and then obviously being admitted for whatever conditions, that's already making people vulnerable. So there's so many factors that obviously are against a person when you go into hospital. So I think that was the reason why a lot of the hospital um, procedures, for example, like surgeries or routine theatre lists, were obviously reviewed, and not everyone was able to go into hospital or even for hospital appointments. So things had to change. So, and I think that's the reason why, because there's a high chance if you go into hospital, you would have caught it. And I think we've heard lots of people, I'm sure you know people that did go into hospital and said that they actually caught it in hospital. So I know of quite a few that it happened to. Some recovered, thankfully, but some didn't make it. So it is a concern, I would say. Yeah.
What else can we do? What else can the medical people, your people, the medical people do to help curb this spread?
Well, usually in hospitals, so like in the hospital I work, it's really contained. So I think hospitals usually, and I think you must be aware with Sika being in Bedford Hospital, that they would take really strict control. So one way of looking at it is obviously when patients are identified in certain wards in the hospital, then that ward is then isolated. So that means everyone is aware that that ward is specifically on the isolation ward. So meaning that no one else will, so no other personnel or people that are foreign to that ward would be entering or leaving that ward. So it's to contain and minimize the risk of infection and passing it on and spreading it. So that's what would usually happen. So the ward will go on alert, they'll be in isolation, everyone will get tested, staff and the patients. And obviously, that's how usually the situation will be contained. The person who obviously is infected will be isolated in a different room, nursed in a different room, and obviously they need to be moved onto a COVID ward. That would happen. So this would happen on medical wards, on psychiatric wards like the hospitals I work on. To be honest, the hospital that I worked on when we had the first wave of the pandemic, they managed it really well. So the department I worked for, the director, the medical director, actually had weekly rounds with us. We updated the patient's care plan. So we would update the care plans, risk assessments. We'd ensure that people were getting tested, and then following on from that, the numbers were contained and the wards were isolated. So we were kept up to date. So there's a lot of communication going around. So whether it's face-to-face communication with the teams, with different professionals like medical professionals, testing going on, isolation, and then treatment if necessary, and management of specific cases. And then, in addition to that, obviously, later on, people have started to get vaccinated. So, most of our patients on the ward are vaccinated, obviously, with consent, discussing it with families. So, all these things play a role, Apoku. So, I think to be fair, yes, there might have been a large number, 1 in 10, that obviously, when they went into hospital, they did contract it, and that was in the early stages of COVID-19, when things were still very, very high, where the numbers were very high. We were seeing thousands of people dying daily. It was thousands that were contracting the virus. But having said that, since last year March to obviously now in August, things have changed a lot. I would say those figures are not as high. I would say there's definitely less number of people getting infected if they're going into hospital. And as you know, from Sika working in theatre, a lot of her lists would have been managed, like emergency surgeries would have been taking place. So all non-essential or non-emergency surgeries would not have taken place. Elective maybe, so some surgeries that people needed it, but it wasn't that urgent. Those are elective, would obviously have been cancelled, or some of them would have been rearranged or postponed. So all this would definitely help to contain it. So the hospitals in itself, I would say, are definitely equipped, from management, from nursing to medical, to all professionals working in the hospital. Even the porters or the people working in the pharmacy, and all the other professionals, everyone is kept up to date with the COVID protocols, with the COVID rules. If there's emergencies, what to do, especially so if there's emergencies on a ward, if someone becomes unconscious and you need to respond to an emergency situation, then we all have, there's a protocol we need to follow, in terms of managing the situation, especially if the person is COVID positive or you entering a ward that where there are people with COVID. So it's all very contained, I would say, moving on from last year.
Well, the other question I want to ask you, let's still stay with that same situation. Definitely, when people are all being taken into hospital, the first thing they do is they test them for COVID.
Yes.
I know that for a fact. They'll test you, make sure that you're COVID free. But whilst you're there, whilst you're being admitted,
Yeah. So as you correctly said, people when they are admitted, they would get tested. So that's a definite when you're admitted. If there's a suspicion of people on the ward that have COVID, then you would get tested again. It's not routinely done. I would say that people are getting tested unless. So what happens is if someone obviously spikes their temperature, starts having a temperature of 37.7, more than that, or if they start to feel symptomatic of a sore throat, headache, fever, and difficulty in breathing, anosmia.
But if they are asymptomatic,
Yeah. So if they're asymptomatic and there's a possibility that they might have COVID, then obviously without testing and without routine testing, we would not know. But I think the question you've asked is important because I think what it raises is that possibly people in hospitals need to be a protocol of say every 3 or 4 weeks that people in hospital will get tested.
all right. Now let's move away from the United Kingdom. Let's go to Australia.
Yeah.
So I'm just ask you about the fact that the Australian capital, Canberra, is going into a snap 1 week lockdown after recording its first case of COVID 19 more than a year. First case, one case, and it will come into effect, or it came into effect from 5 p.m. yesterday. Now, how snap is this, and how? Because just one case since. Hang on a second, let me read it again. The Australian capital, Canberra, is going into a snap 1 week lockdown after recording its first case of COVID in more than a year. What have we got to say about that?
So Australia has done really well with the pandemic. You know, they're quite low on the list, and we've always admired the way they've handled it. But yes, so I mean, for them, they've handled it so well. But obviously, they've criticized themselves, saying that the rollout of the vaccine hasn't been effective, and that's why we saw Sydney earlier on going into lockdown. So yes, I mean, just because they've had just one case, they obviously, going into lockdown. Um, yeah, so after more than a year, and I think that says a lot, isn't it, about the way they've managed the pandemic. That the reason why they got the results that they got, the reason why they've had such less numbers of infection, less number of deaths, and also um, the less number of of the spread, because they've managed it really well. And this is a typical example. You just get one case and everyone's in lockdown. So I obviously there's a lot to take into consideration, the financial implications and everything else in terms of going into lockdown in a country. But they've done so well that obviously they feel that they can do this, just for one person. Because in the UK, it would never happen if it's just one person had COVID that we'd go into lockdown, for example. I don't think it happened in South Africa or USA. So this is definitely a very different approach. Very different, very strict, and very very active approach. But not really much to comment on it. But if that it seems that obviously it's going to be effective, because if one person is infected, from one person it can pass on to up to 100 people. It can pass to as many people as possible, to thousands. So by them containing it in this way, I think it's really good. So yeah, well done to Australia.
Yeah, let's move away from Australia. Let's go to India.
Yeah.
And I saw this article and I was, oh, well, probably because of my lack of knowledge of medicine and all that. So
I wouldn't say that. Your knowledge is brilliant, Dr. Book.
what's going on here? I'm just saying that there's fears over sharp rise in diabetes in India because of COVID 19. And I'm thinking, how does that work out? Now, reading the article, it said that a certain Mr. Shah, who had no previous history of diabetes, was administered steroids, which are used to treat the coronavirus infection. So the steroids reduce inflammation, we know that, in the lungs for COVID 19 and appear to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off it. But they also reduce immunity. That's the explanation here. They reduce immunity and push up blood sugar levels in both diabetic and non-diabetic Rebecca, I can understand, you know, the language here, but at the same time, I really need to find a huge medical cap to put on before I can really get what's happening. So the steroids push up your blood sugar level or what?
Yes.
So if you don't,
Yeah. So steroids definitely. I mean, so this is really interesting, isn't it? That obviously, and your medical knowledge is brilliant, Poku. You've got a lot of knowledge. So yeah.
I didn't say that.
So what happens with steroids? Steroids actually create insulin resistance. So what it does is steroids are obviously medication that we use for COVID-19. It was one of the treatments that was trialed and researched and showed good evidence for that. If people were given a course of steroids, it was very cost effective and it was also very clinically effective in reducing inflammation of the lung caused by the COVID-19, the SARS-CoV-2. So it is a very effective treatment, but unfortunately, with steroids, it has lots of side effects. So we know, so a lot of people will know steroids from the other conditions that people get it for, and also like people that are bodybuilders. So there's always a risk that when you take steroids, that you know that it's going to cause a lot of, can cause some side effects, and it does, even from short doses. So we also use it for asthma. So people that have severe asthma, that obviously, and severe lung infections that are not clearing up with antibiotics, or people with asthma not benefiting from inhalers, they obviously go on a course of steroids and it usually helps. But yes, the side effect profile is significant, and that's what's been picked up in India. So Mr. Shah, he was admitted for 11 days in hospital and critically, and then he had steroid treatment and developed diabetes. So steroids in itself, the side effects it can cause, it has a long side effect profile. We can go through, but one of them is obviously increasing the blood sugar level. It works a lot on the endocrine system. And so, one of the ways in which it obviously affects the insulin. And because it increases the blood sugar level and not enough insulin is being produced, it causes some insulin resistance. And therefore, the person has a higher chance of developing diabetes. So, insulin resistance, as you know, when people get diabetes, is when the blood sugar goes up, our insulin is produced by the pancreas. So the organ that obviously helps us when, for our blood sugar and maintaining blood sugar levels. But for people with diabetes and with insulin resistance, obviously the cells, the cells that produce it in the pancreas get damaged and are not able, become resistant and not able to detect that there's a high glucose and that are not able to produce the insulin. So this is where the mechanism of how it actually affects the body. So when your sugars go up and insulin is supposed to be released to pick up the sugars and control the blood sugars, it's not able to do it. So what happens is resistance develop, insulin resistance, and the blood sugars remain high. And that's when people get diabetes. So it's a combination of obviously increasing the blood sugar levels, creating that insulin resistance that the pancreas is not able to do the job it's supposed to do, So, and that's why we get diabetes. So amongst that, steroids obviously cause other sort of concerns. But I think what they're picking up, which is really, it's quite worrying, is they're saying the worry is that COVID-19 could trigger a tsunami of diabetes in India after the pandemic is over. So that's from Dr. Rahul Baxi, a Mumbai-based diabetologist. So they're saying that even 10%, 8 to 10% of his patients in Mumbai with no history of diabetes contracted COVID continued to have high sugar level months after recovery that were on medication. So I think there's possibly a link because steroids in itself wouldn't cause such a serious concern. So there's probably a combination of someone getting COVID together with the treatment that's obviously triggering this as well. So then I think so in India, the statistics very high is 1 in 6 people in the world with diabetes. So that's what they have in the India. That's the statistics. 1 in 6. It's a home to 77 million diabetics, and it's a second to China, which has 116 million people that have diabetes. So this is something obviously um, quite concerning, isn't it? It will be good to hear from Lyndon, our expert in diabetes.
I was just thinking about Lyndon. We're calling to bring him on one of these days and see where the link is with diabetes and COVID-19.
Yeah, I think that would be a great show to do. I mean, usual side effects of that will be fantastic. So, usual side effects with the steroids is heartburn, indigestion, increased appetite, weight gain, difficulty sleeping, changes in mood and behavior, feeling irritable or anxious. We know that some people do develop psychosis as well, increased risk of infections, high blood sugar or diabetes. So these are definitely side effects. Cushing syndrome. So it can cause a syndrome where people can start to bruise easily, become quite puffy in the face, also causes glaucoma and cataracts, and depression. So steroids is a treatment. Obviously, when you take any medication, we need to be aware of the side effects and the effects of the medication.
All right, let's do the numbers. We have got only
I
5 minutes.
can't believe the time has just gone and we're just going on about, and we've done like a worldwide amazing broadcast of India, Australia, UK, yeah, and South Africa as well we included in the beginning.
Yeah.
So it's been great. Yeah. And yeah, we have to get Lyndon on to talk about the diabetes. I'm definitely geared up to do some more research on diabetes and COVID-19.
I'll do that too.
Yeah. So, in terms of the Worldometer, the figures today, the 13th of August 2021, the total number of cases globally is 206,254,882 positive cases. Total number of deaths are 4,348,282. So still very significant in terms of the number of people that have died. And every life matters. Total recovered is 185,105,477 positive cases. And the top 5 countries, as of the Worldometer, USA number 1 with 37,203,649 positive cases, with 636,298 deaths. Number 2 is India, 32,117,826 positive cases, with 430,285 deaths. Brazil, number 3, with 20,285,067 positive cases, with 566,988 deaths. Number 4 is Russia with 6,534,791 positive cases, with 168,049 deaths. And number 5 is France with 6,398,983 positive cases, with 112,487 deaths. UK number 6, quite close to France, I would say. And that is a bit of a concern. I do predict it's going to move up. I'm sorry. But that's my prediction, and I'll tell you in a minute why. So, with 6,179,506 positive cases, with 130,701 deaths. And South Africa, as we know, still obviously experiencing some difficulties with the COVID, and it's number 17 with 2,568,5 511 positive cases with 76,247. And Ghana, quite low down. Just trying to, I think I've gone, yeah, I've just gone right past it. 103, as you said, yes, with 109,428 positive cases and only 899 deaths. I'll do the 24-hour figures for UK. But just to say, the UK, why I'm saying that there was an article on Spain and how since the holiday period, because of the travel, we can probably talk about that tomorrow as time's up. But because of the travel thing, the numbers are going up. So 33,074 in the last 24 hours in the UK with 94 new deaths. So it's another 60 plus deaths in the last 24 hours. So that's significant. Yesterday was 29,489 positive cases with 104 new deaths. So that's quite significant. I do predict England is going to, UK is going to move up on the board in the top 5 positions again. And also that we possibly might have another lockdown at some point. Yeah. Yeah. I think it might happen. Let's see how the figures go, and especially after the holidays and kids going back to school. But you know what happens with our predictions, unfortunately. So it's not something that we'd want, but stay safe, wear a mask, hand sanitize if you can, you know, maintain safe social distancing, self-isolate if you get symptoms, and, you know, just, yeah, just spread the love and not the virus. And yeah, have a fantastic. I cannot believe it's Friday. It actually, the week has gone so quick. Exactly. I'm just thinking, you know, I just cannot believe. Thank God it's Friday. You know, I've got a weekend to look forward to. Hope you're having a fantastic weekend. Are you going anywhere this weekend? Okay, we at the Light Center this weekend at the Secure Mahikari Sun Center in Croydon. So I'll let you know how the travels to London goes and what's happening on the tubes, keeping my eyes open and doing some research. But I suspect people will be still taking it very safe.
Yeah. Thank you very much, Dr. Seshna Mudlia, for joining us there. Have a fantastic weekend, you and your family.
We will. Thank you, Poku. Lots of love to everyone and enjoy the sunshine. Hope you're going to get the barbecue out and have a nice.
Yeah, well, I'll try. I'm feeling a bit lazy. I just want to chill out.
I'll have to send you some spices so you can put on the braai. I will.
Absolutely.
I'll have some spices ready for you whenever someone's coming up to Milton Keynes. Please collect it.
Thank you very much.
Okay. Lots of love. Bye. Have a fantastic day.